Righty. So my name is Megan Rodriguez. It might be a little tricky because it says Sandy Morris. I'm on her Zoom account. So I work with Sandy. I'm the manager in the Department of Resident Life for activities. So I work closely with Sandy as well as the rest of our team. So it's great to see your faces and get to know you a little better. And we're really happy to have this program here today. I want to say thank you to the new Resident Orientation Committee for developing this program, and it's wonderful that they've figured out a way to do this even in the age of COVID when we can't be all together and we can still see each other and hear each other, so thank you so much. Because of the group size, I already told you that we are recording the session, so if you don't want to be on this video, then you're going to want to turn off your camera. And I'm just admitting more people as they come through. You'll still be able to see and hear the presentation even if your video camera is not on. Because of group size, we're going to be holding question and answers until the end. So what you can do, you can ask your question at that time by either physically raising your hand, and we will kind of put you in order as we see you raise your hand, and then we'll ask you to unmute yourself as we get to you. You can also type your question in the chat box feature. Should probably be at the bottom of your screen. There's a little chat icon. Or you can use the Zoom raise your hand feature. And so I'll be kind of trying to monitor all of those different ways of communicating to catch who wants or who has a question, and we'll get to you in that order. Let's see here. This program will re-air on channel 1390 this Thursday at 2:30 p.m. And when we have two speakers today, if one of them has a PowerPoint, so when they share their screen, that means that their PowerPoint image will become larger and will take up the majority of the screen once it begins, and that will be most of what you see, and that's normal. So, and then once they're finished, that will go back down. Alrighty, so now I know that Ellen had a few things to say, but I'm going to go ahead and introduce Linda Cushman to say a few words and then introduce the next speaker. Linda is a member of this committee, and she is also the chair of the mentor program, so we're really happy to have her here today. So Linda, if you want to take it away, you might have to. You're already unmuted, it looks like.
I think I can talk.
Yep.
Well, welcome everyone to the second session of Life at the Forest that's being brought to you by the new Resident Orientation Committee, of which I am a member, and as Megan said, chair of the mentor program. And I'm here to introduce the speakers. Is that okay, Megan? Are you ready for that?
So, Ellen, did you want to?
I just had a couple of little tidbits. Can I just squeeze those in before we go to the speakers? Just to sort of housekeeping details. I sent a letter out to all the new residents in email saying that I'd be happy to send you the copies of the PowerPoint slides of the speakers if they had PowerPoint slides. And Karen, again, has agreed to do that for this week. So any of you that want copies of the slides, then just please email me sometime this week. And anybody else is on the program who wants copies of the PowerPoint slides can email me also. Just go to your little book and look up my email address. It's easy enough to find. And that's one thing. And then the second, you each and everybody who's on the call should have received information about joining committees in the next couple of weeks. Information about those committees can be found in the connection room. There are a whole host of notebooks in there that you can read and find out more about what committees you might join. Just as an example, I joined the new Residents Orientation Committee after I'd hardly been here, and look where I am now. Oh my goodness. So just saying, you know, it's a great way to meet people, and that's really why I joined what I did at the time. So those are my two little plugs, and now back to Linda.
Okay, today we're going to hear from Leanne Bailey Clayton, Director of Health Services. And Karen Henry is back with us again. She's the Chief Financial Officer of the Forest, and they will be talking about clinic services and the financial ramifications or paying for the medical services that we receive here at the Forest. So I don't know which of you plans to go first, but whichever one can start now.
I think it was Leanne.
Leanne?
Yeah, I was going to go first, and I apologize. I was trying to work with my lighting a little bit. I look like I'm in the witness protection program for some reason this morning. I apologize. If y'all let me flip one more light switch, it might help. Oh, that's a little better. Is that glare too much from the blind? Or is it okay?
It's okay.
Okay. I apologize for that. I was just having some lighting problem this morning. So thank you so much. Could I just ask a quick favor? Could I just ask for the new residents to please just say their name and how long they've been here? I see a lot of people I recognize. I just haven't been out and about because we're, under the COVID umbrella down here. And I just wanted to make sure I knew who folks were. Is that okay? Is that all right in terms of use of time?
Yeah, it would require everybody to unmute themselves to say their name.
Okay. Or if folks just want to raise their hand, I can look at their names if they want to just do their little raise the hand thing.
Anyway.
Okay, that's great.
Jim and Mary Duvard.
All right.
Since January.
Okay.
March 31st.
All right.
I can't raise my hand. We are Judy and Bob Mace. We came in the middle of January.
Great. I've met Miss Mace in the hallway early on. Great. Thank you. I appreciate you taking just a little bit of that time. That helps me. Like I say, I know the folks that have been here a long time, so I just wanted to make sure I was, understanding since I haven't gotten to see people in person. I want to thank you for joining this session and series because you move into the forest, there's a lot of information, and then you turn around and you have a lot of boxes to unpack. And somehow in that we start to think, oh my gosh, I might be a little bit overwhelmed. So Karen and I want to walk through some of the services here, what finances look like for those things, and what some of the language looks like in your resident handbook as well as in your residence and care agreement, so that you will have an overview of what services look like in the clinic and the health center. Some folks move here from out of town and they immediately, immerse themselves in the clinic and the services that are provided there. And some folks move from local and they've had a doctor for a long time, and it may be that they never transition to the clinic, or they may utilize that for flu shots and TBs and urgent care and things like that. So we just want to give you an overview so that you know, A, if you're utilizing that, what you can expect in terms of service, but B, if you decide to utilize that in the future or intermittently, what's available to you there. So I'll start with the clinic, and I wanted to make you aware that we do have a physician contract with Duke Geriatrics. We have had that since the Forest opened, and that has been a very bountiful relationship for us. I will tell you that during the time of COVID, we had just launched My Chart with Duke, and in solidifying that relationship with Duke, we were able to transition, though it felt like rocks uphill, we pushed them far enough, and we were able to solidify our relationship with Duke Lab. I can't express to you, one day if you have absolutely nothing to do and you want some maybe useless or not information, come and talk to me and I will tell you how important it is to have Duke Lab. That has been a wonderful relationship with us. It has served us well during this time of COVID. And the one day Karen will probably get the billing straightened out, or maybe not. That has been critical to us managing COVID and testing. So I just wanted to tell you, as we've expanded that relationship from our Duke physician contract to MyChart being part of our system to now Duke Lab, it has helped us exponentially to further grow that relationship with Duke. So I will tell you that has been a long time coming, and we are very glad it's here. It has made many things seamless for us. And in a time that we suddenly all had to just run back home and not see anybody and not do anything, it was nice to know we had those systems that were moving so seamlessly. So I just wanted to mention that to you. We do have two geriatricians that work in our clinic, Dr. Hanau and Dr. Boer. We have a nurse practitioner, Holly Winger, who is also a Duke employee. We have a nurse clinic manager, who is Birmo Nzanga, who has been with us for a number of years. And Laurie Locke has been with us. She's a Pioneer employee. And she is the person that makes everything go around at the desk. I couldn't and wouldn't want to do Laurie's job because it just takes multitask to another level. And the feature added for urgent care has been very important here. As we know, our primary care physicians are very busy. And in that, you know, it's always better if you can go to the urgent care at the Forest instead of going to an urgent care on XYZ road, whatever it is, because you can do everything you need to do here. If for some reason you need to follow up for wound care or blood work or any of those things, we'll communicate with your primary care physician and say, hey, this is what's going on and this is what happened. This is our plan for this particular patient, and they will communicate on Duke MyChart or by phone, whichever is necessary. And then your primary care physician can have a good understanding of what's happened with you for this short interim time that you had an emergency, if you will. So that has been a feature that has been necessary to add the nurse practitioner. That was very important. And I guess this is 2 or 3 years old now, Karen, isn't it? I think so. Yeah. So to say it's new sounds a little silly, but since you're new residents, I'll just tell you that it's a new service to us. We've had a couple of years. We do have, normally we have dental services that are here once a week. Dr. Duffy has decided to focus on her primary practice. So we do not currently have a dentist. We are recruiting for a dentist. We are in a situation, we have 2 exam rooms with all the necessary dental equipment here. If anyone knows a dentist, let me know. But it's a very nice offering for the dentist that comes here. Typically, they have been coming once a week for about 3/4 of a day. So we have every anticipation of bringing that service back here. We have not had a lot of response to that, and I can't explain why, other than the fact that people are kind of hunkered down and you know, working in their own spaces and making things safe for people. So I have a couple. Dr. Duffy's helping us look for a dentist. Dr. Little is helping us look for a dentist. And if you know a dentist, let me know that's interested in working here. But regarding Dr. Little, she is our medical director, and she's been with us about a year and a half now, almost 2 years. And she has been phenomenal. She is our medical director. She works at Duke as well. She fills in our clinic from time to time, but she's on the phone with me every day at this point discussing isolation. We have an isolation call every single day. She's discussing outdoor visitation with me for the health center. Dr. Little and I had no idea we were going to have such a need for such an engrossed relationship right away. And I will tell you, it has been amazing. We are very lucky here to have Dr. Milton Little as our medical director. You would have thought she'd been here 10 years the way she has responded and embraced the needs of this community. So I feel very, very good about that. The other services that we have is we also have, as I mentioned, Duke Lab services. We have mobile x-ray services. We have therapy services with Legacy, PT, OT, and speech. They have been our provider for, what, 12, 15 years, Karen? Excuse me. And they will come to your home. You can see them in the therapy department. They will see you if you, let's say you broke your ankle and needed to come to rehab in the health center. They would see you in the health center. They're everywhere. They need a little like credit card commercial. They're everywhere you want to be. But
I think Jane's a pioneer too.
yeah, I think so too. She's been here longer than I have. And
Long
I've been here
time.
21 years. Yeah. So they're just very much entrenched in our services, and they're part of our organization here. And we're very glad to have them. I've been here 21 years. Jane Hamilton, the director, has been here longer than I have, 23 or 4, I think. So, you know, longevity has its pluses. And I feel like that Jane certainly, and I meet with Legacy often, and they keep our contract and our service at the forefront of what is important to them as an organization. So I feel very good about that. Please know any of these services you can resource through the clinic. Either your primary care physician or one of our physicians will write orders for you, get you connected. And if you don't know Laurie Lott, get to know Laurie Lott, because she can connect you with anybody that you need in terms of a service. Okay, so that's very important. We have several levels of pharmacy services. So I will speak to the independent living first. Durham Pharmacy, as well as multiple other pharmacies, are currently delivering, but we do have a contract with Durham Pharmacy to deliver medications here to independent living. Laurie has been currently delivering those during these interesting times we're in. But normally what happens is we phone you and let you know your prescriptions are here, and you come down to the clinic and pick those up. You may have a pharmacy that is willing to deliver as well. We're happy to work with them. That's not a problem. So just know you can touch base with Laurie, make that a cashless system, you know, and it's a matter of you getting your medications. We can fax in prescription refills, a lot of things like that. As far as the health center is concerned, Neal Medical is our pharmacy. And just to know that under the regulations of long-term care, we are required to use a long-term care pharmacy. So that is a change for you if you are in independent living and then become a resident of the health center. You will have a change in pharmacy. We have a contract, binding contract with the DEA, as well as with the state regulatory agencies that explain how we can package and administer pills. And that's done by Neal Medical for us, so that we are in regulation requirement for that. So it's important to know that if you do have a pharmacy in independent living, that you're not suddenly just going to schlep all your bottles down to the health center and then have a bunch of bottles and, you know, the nurses pour those in their hand and give them to you. That's considered dispensing, and that's outside of the Nurse Practice Act. So that is a change when you are in the health center. Now, if you're in the health center for a Medicare stay, we get those medications from Neal Pharmacy, but they're at no expense to you whatsoever. That is covered under your Medicare Part A, and Karen Henry will get the bill for that, and she will take care of that. So just to make you aware of that as something that transitions. Anything you feel like, oh, audiologist comes to the Forest. We have Duke Audiology, as well as we have, I knew I was going to forget her name. Who's the other audiologist? Do you know, Megan? I'm sorry, I'm drawing a blank. We have a second audiologist that's come here.
Is it Shelley Cristobal?
Yep, that's her. Shelley Cristobal is the other audiologist that comes here. So we do have the ability to have that right now, as well as our podiatry services. If you have an audiology need, we are working that out with audiology and podiatry for individualized appointments for necessary things in the clinic. We have the ability to have singular appointments where we're cleaning between every appointment, and the audiologist, Dr. Cristobal, and our podiatrist has they have committed to going through our process for infection control to be able to see people. So if you have an urgent need or an immediate need, you can touch base with Laurie about when those folks will be here. And of course, that's announced in the Forest Forward as well. Okay. So I'm going to move on now to the health center. Any questions about we're holding questions, right? Okay. So if you have any questions about the clinic, jot those down and I will answer those when we get to the question part. So as far as the health center is concerned, we are comprised of a combination license. We have 58 skilled care beds and we have 34 assisted living beds. And those particular licenses, we're a combination facility, so we are regulated by the Centers for Medicare and Medicaid Services, which is at the federal level. We have 4 Medicare Part A certified beds. Those are in a distinct part. We are only allowed to bill for room 242, 43, 44, and 45, okay? You can't decide that you want to just send the federal government a bill for room 256 because you're going to get a big rejection notice when you try to do that. So just to make you aware of that, we do have 4 specific beds. We have had a few opportunities over time that we have needed to reach out to some of our partners, which are Hillcrest, Carroll Woods, and Crosdale. If our beds were full for some reason, those 4 specific beds, you have a couple of options. And you don't have to remember all of what I'm about to tell you because you would probably lose your mind if you tried to do that. Jessica Hackett is our resident navigator. That name is as important as Laurie Locke's name because if you anticipate going to the hospital for a planned surgery or procedure, you will want to be in touch with your social worker. Then Jessica will follow you in the hospital in an anticipatory way of you going to the hospital. And also Jessica will follow you in the hospital and be in touch with the case manager. In being in touch with the case manager, we will learn more and more about what your needs are when you're in the hospital. So let's pretend you're having an elective hip surgery. That's a good one to talk about. So an elective hip surgery is going to make sure that when you are in the hospital for your 3 overnight stays, that you come back to us and we will have a Medicare A bed for you. Well, let's pretend that 4 of your friends from the forest are in those Medicare A beds, okay? Maybe they're people you know, people you don't know. We're just going to pretend they're all your friends, all right? Just to make the story fun. So there's not going to be any need to be distressed about that because we have 2 options. Can y'all hear this blower in the background? Okay, good. I was hoping that my machine was muting that. I apologize. Every time I have a meeting on here, the guy blows out here on the carport. Anyway, so I didn't want you to be disturbed by that. So we have 2 options for you. You can go to one of our partnering communities that have Medicare A beds as well. We make the discharge planners at those facilities where you would like a private room. I know where Hillcrest is concerned. I believe it's $37 extra a day to be in a private room. Daniel knows when we call him at Hillcrest that our residents are going to want a private room. So we do make him aware of that. All of our rooms are private, so we are fortunate that we do not have to worry about roommates or things such as that. But let's pretend that we know for sure, excuse me, the federal government doesn't allow you just to come to a Medicare bed and go, oh, well, I guess I'll leave when I want to. That's not how that goes. There's a formula and a plan that's constantly created by the Jessica is the discharge planner for us, therapy and their team, the nursing team, and the federal government is saying, Rachel, she's our what's called an MDS nurse, minimum data set. She is creating a federal form that we submit, and they say, we are projecting that with these comorbidities for this resident and this elective hip fracture, that this person should need to be with you 13 and a half days. Okay? So that doesn't mean we're going to kick you out in 13 and a half days. Okay? That's not what that means. There has to be a projection. Nothing can just have an infinitum type of time frame. So what happens is your 4 friends are there and everybody has an anticipated discharge date. All right, so Ms. Tuchinski, I'm going to use you because you're my buddy. So Ms. Tuchinski's in the hospital and she's had her hip electively replaced, and she's going to need to come. And Miss Barrett is in one of the Medicare beds, and Miss Barrett is going to discharge on Tuesday, and Miss Tuchinski needs to come on Tuesday. So Miss Barrett discharges in the morning, Miss Tuchinski comes in the afternoon. So it's called bed utilization, that we do that very well here. I've been doing that for, oh gosh, I guess, am I old enough to have done it 30 years? I think so. We'll say 25, that sounds better. 25 years, and bed utilization is an art, let me just say, so that we can, in fact, utilize our space for everyone. But let's pretend Miss Barrett wasn't ready to go home yet, and no one was anticipated discharge for Tuesday or Wednesday. How would we help Ms. Tuchinski? We would do 2 things. She would have the opportunity to use a respite stay. What that means is everyone has 15 prepaid days. You prepay that when you move into the forest, okay? And it's the other word that you like, free. They're free days, okay, because you've already paid for those. And what happens is Ms. Tuchinski will go to Olson, to a bed that's not Medicare. She does not incur any expense during that time. We know she's going to be there approximately 4 days, and then there's going to be a Medicare A bed for her. Ms. Tuchinski may tell Jessica, I don't want to do that. I've heard great things about Hillcrest. I understand they have a bed in a private room. I'm going to go do my rehab there. That's okay. There's no problem with that. You will go there under Medicare A stay. The clock ticks as it always does. You're there a week and a half. You don't like it. We have a bed. They transfer you back here. Okay? So there are a lot of ways for that to happen. So please don't get tangled up in, is there going to be a bed for me? There's only 4 beds. We are not only creative, but have a lot of resources to make sure that we're helping you through that process. You are not on your own with that. And let me just tell you, for 21 years, I've been being creative here. So Jessica always has me at her ready so that we can do the things we need to do. Let's say that you did so well with therapy right out of surgery that you can go home. Okay, well, what does that mean? So we will talk to you about if you need a little companion help in the morning, if you need to have some meal delivery for a few days. Rehab can come straight to your cottage or apartment and help you. There are just a lot of facets of the way to help that. Now, this talk could go on and on if I started talking about the forest at home. So I'm not going to do that except to tell you that you all are aware that we purchased a home care license. We are actively working on putting that programming in place. We hope, fingers crossed, that we will be able to go live on January 1st. And there will be 3 levels of assistance out of that program. There will be certified nursing assistants, there will be companions, and there will be sitters. So the state of North Carolina says you have to choose what service you're providing. And those are the 3 things we choose. Later, we may choose nursing services. We may add other things. You have the opportunity to pick off the menu. But we wanted to make sure that we had our program solid and locked in and successful and moving in the right direction, serving our residents as it needs to before we add any specialty items out of that. In that particular formula, there's an agency director, which is me, and then there's also an RN that is overseeing all assessments and is making sure that with whatever help you have in your apartment or your cottage, that you are safe. So let me say this with a big exclamation point. The forest at home doesn't mean you can live in your home and be in the wrong level of care. It doesn't mean you can live in your home and be unsafe with a couple of hours coming in every day. What it means is it's an extra layer to make sure that you're safe, but at what point the forest feels that the objectivity is needed to say you really need to have assisted living or skilled care, that we're still going to raise our hand out of our obligation to you contractually and just as good people and say we need to look at another level of care. So I just want to make sure that's clear. because that can come up in conversations along the way, and I call it contract amnesia. That, you know, I'd never like to get to that point of the conversation with anybody, but sometimes we have to remind people as their status is changing, what they actually ask us to do for you when you came here. So I try to be the one that shares that message because I've shared that many times. So I just wanted to make you aware of that piece of the service. So let's pretend that your spouse needs to move to the health center permanently and you're going to continue to live in your cottage, okay? Well, that's fine. Karen will talk a little bit about what those percentages look like and how those finances work and the way that happens. But just know we have social workers, resident navigators, myself, a whole group of people that are very good at this. So if you are in your apartment or cottage and you're suffering in silence over this anxiety about this upcoming knee replacement or hip replacement, you heard it here that you have resources. We are here to help you. We become automatic pilot professional daughters or sons or whatever we need to be. And we can help you manage your sons and daughters too. That's a service we don't put in writing, but I can tell you it's very helpful. But we do. We help keep your family informed. And as I explained to one of the social workers the other day, we take the threads of everything going on with you and we pull it through the system and we create a beautifully woven blanket for you to have a plan to get your surgery, get the care you need, get back home, and get on with whatever your fun is. And keep your family intact as that's happening. So I just wanted to make you aware of that as well. Let's see. That's the list that I was given to cover. Megan, do you want me to do questions now? I mean, I could talk about this for hours, so you need to tell me I'm done.
I think we did have a couple of questions come through the chat, but I think we can, well, okay, I'll ask those really quickly and then we can move on to Karen's. The first one was how many beds will be in the new health and wellness center? And then in addition to that, if you can please touch on the changes you expect with the proposed new building, not just the beds.
Sure. And in fairness, I do want to mention that Anita's going to be doing a formal presentation of all of the new project. So I don't want to take up too much time here, but to answer the question, we currently have 92 beds. We will have 90 going forward. We will go from 4 Medicare beds to 10 Medicare beds. They will be, so just to give you, it's called Small House. It's going to be called, it's Small House 90. We will have 9 households of 10. 2 households create a neighborhood, north and south. Okay, so the idea behind the small house is, well, and you need to know we've had a consultant who is phenomenal and has done this from the ground up, from greenhouse up. She has done this, and Anita, myself, the whole team has been very, very comfortable to raise our hand and say, that's nice that you did it that way in Mississippi, but this is how we're going to do it at the Forest, or this is how the Forest expects it to be done, or this is what the service model is at the Forest. So you need to know we didn't take a sheet and check off a list and go, oh yeah, we're doing it this way. Nah. So the biggest thing you need to hear is that our staff members, our team members will be working as a core group together. So in a household of 10, there will be dining representation, housekeeping representation, CNA representation, nursing representation, and activities representation. Okay? And that becomes a team for, we'll just call it North House 1. Okay? So, and somebody just asked, no, we're going from 92 beds to 90. I think Ms. Carlson asked that. Mm-hmm. So we have a waiver for that. And if you look at our census and our capacity and our actuarial, it is not unusual at all for us to have available beds. in our specialized dementia area specifically. So we have worked the numbers numerous times, and I don't see any problem at all with going from 92 to 90 where that's concerned. But we will have a household that is just Medicare, okay? But there's been a myth here for a long time that you can't use Medicare beds for anything else. Well, that's not true. You just don't bill for them. You don't bill Medicare for them, okay? So we will have the ability to have some, let's say someone has an acute hospice need. We will have the RNs in place there to make sure we're meeting that type of need. There are a lot of needs on this campus. You can have a hip replacement, or you can be at end of life. You can have a complex dementia. And we're setting these households up so that we are able to do not just a variety of care, but to have the opportunity to have these teams that are able to meet a lot of needs. So we are not utilizing the terminology universal worker. We're not doing that. What that means is that everybody does everybody else's job. That's not what it means. But you and I all know it doesn't take a CNA to go in and put somebody's toothpaste on their toothbrush for them. It doesn't take a CNA to do that. But everyone will have some cross-training in their area of expertise. But those things that are licensed and certified will stay with those licensed and certified team members. Okay? What was the other questions?
Another one was, it says we chose, am I unmuted? Yeah. We chose the forest because, among other reasons, the health unit. What likelihood is there if we need to be in a bed in the health unit, a bed will not be available and we will be sent off-site?
Well, I think I just explained that. So
okay.
I just explained that in the conversation. Maybe that was an earlier question.
Okay. Yeah, it was. Ms. Tuchinski raised her hand. Did you have a question? You can unmute. Okay.
Yes. The license for the forest at home.
Yes, ma'am.
Is that strictly for residents here, or is that going to be expanded to people in the community in general?
So my understanding of our purchase of that is that it will be for the community as the independent as well as the health center. Now we do have a new program that is starting called Early Acceptance Program, but this forest at home will have to be well entrenched in the community here on this property before we would ever do any expansion. And that would be a very strategic initiative. And I would consider that, and Karen, correct me if I'm wrong, that would be considered an area of growth for that particular project.
That's correct, Leanne. Yep.
Okay.
We're starting with our community first.
Yes, yes.
And I had another question which came up at the finance meeting, which Karen suggested I save till today.
Okay.
Why is the fee per day for a temporary stay so much more than the per diem when you're there on a permanent basis? Because temporary, you're still paying your monthly service fee.
Correct. So Karen, you may have to tag team with me on this. So when you are a permanent resident in the health center, you are no longer paying your monthly service fee, okay? You have moved out of your cottage or apartment, you have relinquished that, so you also are relinquishing the cost for that. So that is where you have bought into the Forest at Duke, you have paid your entry fee, and now you are only paying a percentage of our per diem rate, all right, which is set forth by all the formulas that Karen utilizes for Medicare. So you are only paying a percentage of that. You are no longer paying for your, you're not paying for a meal plan. You're not paying, separately for that. None of that's carved out. It's all inclusive. And you are paying that as a percentage because you bought in to the Forest at Duke and to that health plan. So if you are a person that is utilizing temporarily the space here, so for 15 prepaid days, you're not paying. But if you are exceeding that 15 days, then you are going to have a higher rate, a higher daily rate, because you have not moved into the vested part of your lower percentage.
That's an absolutely beautiful way to say that.
Is it? I've never said that out loud like
That
that.
is beautiful.
Mhm.
And
Okay.
and most residents never get to that point where most residents utilize their 15 days and and then they go back to their apartment and not pay that higher rate. So it's a very minimal amount of people who ever get charged that amount.
Right. And let me add one little other bit of information. You may never, hold on to this, but I just want to tell you. So, we always have the regulatory factor we're working with. As of day 30, we are given the situation that we have to decide with that resident in terms of a discharge plan, if they're going to be permanent or if they're going to be going back home. We have the leniency of 3 or 4 or 5 days to say someone, we know they're leaving, they're going to be leaving on day 3, because as of day 31, you're not respite anymore in the eyes of the state of North Carolina. A respite stay by definition in the state of North Carolina is 30 days or less. So we get into a commitment of having to make a decision with you. Now, Mr. Chinsky, you said, it's very clear, 3 days after my 30 days, I'm clearly going to be going home. I needed a walker, a grab bar, whatever the case may be. We're not going to say, oh, you have to decide. You have these 3 days. That's not the way it is. You'll just continue to pay the temporary rate for 3 days and then you'll go home. So we don't lose our mind over that, but you have to make sure that you have a concrete plan. Again, none of these programs allow things just to go on and on and on without some definition involved. Is that helpful? Okay, great. Thank you.
Okay, we had a question on the chat, and then Mr. DeBard will get to you after that. Linda Cushman asked, how do you know who your social worker is?
Mm-hmm. So based on your last name, Teresa Schloss is A through K, and Joan Nelson is L through Z. And if you have names that are last names in the, I see Rose Mills and Jeff Collins. If you have last names are in the different alphabet, then you can pick.
How do you spell Teresa's last name?
S as in Sam, CHLAUCH.
Okay, I didn't know she existed. Thank you. She's my social worker, I guess.
Okay. Well, and what happened with COVID is Joan had to go back and forth to New York several times for her father's very ill. And so we had to do some isolation things. So Joan's on the independent living side and Teresa's on the health center side. And
I thought we were followed. I thought we just had someone by our alphabet and then that person followed us all the way through.
That is correct. That is correct. But because with the health department, we had to make a commitment for people not to cross over. We just had to divide and conquer with those two ladies.
Oh, okay.
And like housekeeping, they had one team that was in the health center. With the social workers, we had to do that as well. But no, you were definitely by alphabet. If you're engaged by someone that's not your alphabet social worker at this point, it's because of logistics.
Okay, thank you.
Yes, ma'am.
Right. Mr. DeBard?
My question is, how does long-term care insurance play into this? Or, in other words, should I keep paying for long-term care insurance?
Karen, are you going to address long-term care insurance?
Long-term care insurance comes in when you are a permanent resident in the Health and Wellness Center. So since we are a licensed facility, it depends on your policy. But like any insurance, you have insurance to cover a risk. If you're Bill Gates, you probably don't need insurance. But for others, it is what your protection would be. So I would never say to drop or keep your policy. I am not allowed to do that, but I can give you information that you need to decide whether or not, what your coverage would be. But you can definitely utilize your long-term care benefits here at the Forest. And many of our residents have.
Thank you.
Thank you, Karen.
You're welcome.
Okay, and one more chat question. What is the definition of a Medicare bed? From Pat Thompson.
Okay, so to utilize a Medicare Part A bed, it's called a distinct part. That means we have certified those, or the federal government has certified those 4 beds for very specific service and criteria. One of the first criteria is you have to have a 3 overnight stay at the hospital. You have to have a qualifying diagnosis, and you have to have a need for nursing intervention and rehab intervention. That's what that means.
Okay. Any other questions for Leanne before we go on to Karen's presentation? I'm not seeing any more chats, and I'm not seeing any more raised hands. Okay. Thank you so much, Leanne.
Sure.
All right.
Do I need to stay on the call?
If nobody else has any questions for Leanne, then I don't think so.
Karen, what's your preference?
It's up to you, Leanne. I'm going to try to keep it short and sweet for everybody. They're probably, how long should you have a session? Is it going on too long?
I think you're good for, we're only at 50 minutes, so.
Okay.
Yeah.
Well, I'm going to go. I
Okay.
have 11:15. If anybody needs me, please email me. Ms. Tuchinski has my email address. She'll share it with you. She's my bud. We talk. Feel free to let me know if you need anything, and I'm happy to help. And welcome to the forest. You made a fantastic choice.
Absolutely.
All right. Take care. Thank you.
Well, hello, everyone, and thank you for joining me this morning. And this is the second time that Leanne have been tag teaming this presentation as the leaders in this committee, the residents. They are always making great improvements to the program for your benefit. And Leanne did an awesome job with explaining to you all of the health services that are provided here at the forest. And, you know, I'll tell you what, I know it's confusing for all of you, and I try very hard, as what I try to do is try to make things easier. I'll never understand that as we get older, they make things harder. I just don't know why they do that, but that's kind of a pet peeve of mine. But anyway, as you all know, medical services and insurance, that's really easy to understand, isn't it? Right. Not really. So what I want to try to explain to you is all the things that Leanne was talking about, all the services that are provided here. A lot of those are provided here for your benefit and for your convenience, because you don't have to go off-site to receive those services. However, a really key difference and what to keep in mind is when people get confused about, why did I get this bill from this person? Why did I get this bill for here? So what I'm going to explain is where you get the service, who provides the service is really the key to how it is billed and paid for. So stay tuned on a little more about that. Also, this is a very timely discussion because open enrollment is coming soon for Medicare. And during that time, you're going to get all of these emails and phone calls and TV ads about do this and do this and do that. So I know that you all have a choice, and but what I want to do is make sure that you have the information that you need to make an informed decision. So I'm going to share my screen. Let's see. All right, we good there?
Mm-hmm.
All right. So why is this topic so important? So what is the first thing that happens when you go to the doctor's office? They ask you for your insurance card, right? Exactly. So current insurance coverage is really essential to every provider to make sure that the services are billed appropriately. And what's most important for you is you're not getting a bill that you shouldn't get. So this is really, really important. If your insurance changes, please let accounting staff know right away so that we can change your information in our system so you can avoid those, I got a bill, why did I get a bill? If you're considering making any changes to your insurance coverage, here's a few key facts that you need to keep in mind for any services that you receive here at the Forest. So the Forest participates in Medicare Part A and Medicare Part B. These may be familiar terms to you when you were still working. Medicare does not have in-network or out-of-network benefits. Seniors can choose where they want to go. The Forest at Duke is not, this is important, is not in any insurance company's network. Our skilled nursing facility is closed. So what that means is that only our residents can be admitted into skilled nursing. This really applies if you have a Medicare Advantage plan, not Medicare. So residents will be responsible, because this is all insurance related, not private pay, for any deductibles or co-pays that's determined by the coverage that you've individually selected with the insurance carrier that you have chosen. So here's a little information about Advantage plans. And this is from the Washington Post. So Medicare Advantage plans throughout the last couple of years have become very, very popular. There's several features that include costs for older adults in these plans, and they talk about all of these different things. But as they said in this article, it's really poorly understood. And as I said before, no plan is good or bad. And I'm not making a financial projection or even an opinion about these things. The key to understand is what you are buying and whether it's the right fit for you. That's what you should do in anything that you do throughout your life is, do I really understand what I'm buying? A lot of these insurance companies promote zero premiums and lower costs. But what I always kind of say to people is, does it sound too good to be true? There are pros to the Advantage plans. There's little paperwork, emphasizing preventative care. There's extra benefits like vision and dental that aren't offered in traditional Medicare. It's an all-in-one approach to coverage. You don't have A, B, C, D, E, F. It's just the plan. There's cost controls, including a cap on out-of-pocket costs. But there are also some cons. Access is limited to hospitals and doctors within the network. Rules that can erect barriers to accessing care. You need prior approval from insurance company before receiving needed care. This is important if you receive care here, especially on a Medicare Part A type qualifying stay. You can certainly be in one of those rooms. That is not the issue at all. The care is the same. But if you have an Advantage plan, you will be using your out-of-network benefits, and you will have to be pre-authorized. There's a potential for higher costs for specific services in some circumstances. Sometimes plans drop physicians or hospitals from their networks during the year. They limit their care, some limits of care for traveling. A lack of flexibility. If you enroll in a Medicare Advantage plan, you're locked into that for a year. And Advantage plans have financial incentives to limit services. Okay, well, that's kind of enough about insurance. With that said, I'm going to break it down and look at how does that apply to you at the Forest. And as I said in the beginning, there are many healthcare services that you receive here on campus. Very convenient for you, but you may not be receiving a bill from me because we did not provide the service. So what I did, if you have your handout, that looks like this. What I did a couple years back to try to help people was, what could I do to just put on one sheet for people to go, okay, if I got this service, how is it going to be paid? What happens? So when you look at this grid, if you have that in front of you, I'm going to walk through this. What's really important is to take a step back and say to yourself, okay, what type of service am I receiving? And then what kind of service is that? The place of service, where did you receive that service? Who provided that service? The key to that, who provides it is who bills it. And then that's going to determine how that is paid for. So the first one I'm going to talk about is skilled nursing. And that one, Leanne totally really explained a lot about how to utilize your skilled nursing benefit on a Medicare qualifying stay. And as she said, we follow the same guidelines as if you were in Hawaii or Colorado or anywhere in the United States. We follow the same guidelines as every other facility for following how we bill those services that you, if you're receiving those on a Medicare Part A stay. Where can you receive those services? As Leanne noted, we have a distinct section in Olson, and it can only be in those 4 rooms to bill Medicare: 242, 243, 244, and 245. Who provided that service? The Forest at Duke. So that means the accounting department at the Forest at Duke is going to bill for those services, and we will utilize whatever insurance that you have, whether it's Medicare, traditional Medicare, a Medicare Advantage plan. And one key note to this, that there's a big misnomer. People think that if they are on a Medicare Part A stay, it's 100 days guaranteed. No, that is not true. As Leanne said, throughout the process, there is assessments that are done that is that resident still at that highest level of care to still be billed by Medicare. So you're not guaranteed that 100. So if you are still there after day 21, seniors on Medicare, there is a coinsurance of $176 a day that resident would be responsible for days 21 through 100. But typically most residents have a supplemental insurance that will cover that. And if you do, we will bill that as well. That's the most challenging one to explain, is the skilled nursing benefit that you would receive in our health center. Now, physician services. Leanne then talked about our clinic. So if you go to our clinic and see one of the physicians or the nurse practitioner, the Forest at Duke has always participated. This is your Medicare Part B benefit for your services. You would receive those services in the clinic. And depending on the type of visit that you have, no one visit is the same. If we are allowed to bill Medicare Part B services for the service that was provided, we will do so. The Forest at Duke provided it, so we will bill it in the accounting department, and we will bill your insurance for that. Now, here's some services that Leanne talked about that is where it's that gray area of, where am I getting this service and who's billing it? The dental services. She talked about Dr. Duffy, and now we are looking for her replacement. But if you get a dental visit in the clinic, that was in the clinic. However, who provided that service? Well, that was Dr. Duffy. So since Dr. Duffy provided it, her office is going to bill that. So her office bills that. And that's why many residents, sometimes they'll ask me a question, hey, I got this bill from Dr. Duffy, can you help me with this? And then I look at them and say, I didn't know anything about it. And they said, well, I got the service here. I said, well, you did, but we didn't provide the service Dr. Duffy did. So she's either billing your insurance, or if you don't have dental insurance, it would be private pay. So that's a really good example. Therapy. Leanne talked a lot about the therapy services that are provided by Legacy. You could receive these services in your home, in your cottage, in the Health and Wellness Center. Legacy provided those services. Legacy is going to bill those, and that would follow that insurance there. Any lab work or x-ray work, pharmacy services, same thing. Those services are provided here for you, are available for you to have those services. However, the Forest at Duke does not provide those. Duke Lab is going to bill your insurance. Mobile X-ray will bill your insurance, as well as the pharmacies. Then we had a question about long-term care insurance and whether or not I can utilize that benefit here. Absolutely. So that the insurances that we talked about before are medical services. Medical services that are provided if you go and you have a medical event, those are covered under that type of insurance, health insurance. If you are a resident that lives permanently, your home is in the Health and Wellness Center. Whether you are in assisted living, in Carlton, the Riviera, or Regency, or if you're in skilled nursing in Olson, Holbrook, or Biltmore, that is where you live, and that is what is convalescent care daily living. The insurance that is applicable here is long-term care insurance. So this is private pay. This is a bill that you receive, just like independent living residents, the same time frame as everyone else from Kasia, our new billing specialist, and that is part of your contract, private. So if you have long-term care insurance, you are able to utilize that. Some residents ask, well, how would I initiate that? Well, certainly we would need to, the Forest, help you to initiate utilizing your long-term care policy, because the application requires a lot of information that you would not have. It needs a care plan, which the nursing team would help you with, a copy of our license, other things like that. But once you get it set up, it's really easy. You just send them a copy of our bill, which details out the number of days that you were billed here, and their insurance company will reimburse you. So with that, I am going to stop sharing and entertain any questions you may have. Well, you're all just like, whoa, I need to stop now. It's time for lunch.
Anybody have any questions? You can raise your hand or write it in the chat.
Right.
Oh, okay. Ms.
I have
Cushman?
one question. Can you hear me?
Yes, I can.
This is a simple one. Can I get copies of this chart that you just put up?
Absolutely.
Okay, I have a
Where would I
question.
get it? Would it be in your office?
I'm emailing it to Ellen Barrett, and Ellen said to just let her know, and she will send out the presentation slides to anyone who'd like them.
Okay, thank you.
You're welcome.
Ms. Cushman?
I have a question about pharmacy services in the healthcare. My husband and I are DOD. We use TRICARE for Life military, and they use Express Scripts. So will Neal Pharmacy Services be covered by DOD, TRICARE for Life pharmacy? That's my question.
If you're a permanent resident in the Health and Wellness Center?
Right. Yes, if I were.
Correct. I would need to refer you to Leanne on the specifics on that. I believe that Neal Medical Pharmacy, we have to utilize, when you're in the Health and Wellness Center, as she said, there are specific regulations that You know, the nursing
Right.
team just can't dispense your prescriptions like you are in your apartment. So we have to order those through the pharmacy, but I believe that they utilize your insurance in order to do that.
We get home delivery.
Okay. All right. I hope that works.
But she could work you out with that.
Otherwise, I don't have any coverage for pharmacy services if I were in the health center.
What's that again?
If that did not work, if they cannot bill TRICARE for Life, which is how I get my pharmacy services, they use Express Scripts, but TRICARE for Life is the insurance carrier. If that didn't work, then I would not have any coverage for my pharmacy services in the health center.
I am sure that there is a way to work that out. The people all over the country have TRICARE, and nursing homes are in all over the country. So I'm sure that, and we've had residents previous to you that have TRICARE insurance.
Right.
That lived in the health and wellness center. I just don't personally know exactly how that works, but I know it would. We'd make that happen for you.
Thanks, Karen.
You're welcome. Yeah, what good is insurance if I can't use it?
That's right.
Exactly. And you would hope that working for the federal government, they wouldn't let you down. So, right. So we'll work on that for you.
Thank you.
You're welcome.
Daniel Langmeyer raised his hand. Mr. Langmeyer, you want to unmute yourself?
Is there any Medicare Advantage plan for which the clinic is in network?
We do have one right now. I believe it's Blue Partners HMO that we are in network with, and that is the only one that has allowed us to do that. And to explain a little bit why the forest, because I've had several residents ask me, well, can't you just get in an insurance company's network? Well, it's not that easy. And in particular for the forest at Duke, and this would make sense, we are a closed certificate of need. So we are a closed community. So we couldn't even be in anybody's network because they can't put us on the list because no one else can come here but you. So that's also why we can't participate in networks, because we can't admit anyone to our facility or come to our clinic unless it's you. But I believe it's Blue Partners HMO.
Okay. And Jan Tuchinski had a question.
Yes. Karen, if a person is a permanent resident in healthcare, are there any items that would be billed to them beyond their monthly rate, like special things, or is that everything is covered?
It's going to depend on each resident's own medical needs. And so there could be medical supplies, or say Ensure, incontinence products. We do not build into that daily inclusive rate for a resident in the health and wellness center, because it wouldn't be fair to charge everybody for something that someone else doesn't have. So there could be specific medical supplies that's related to a resident's particular condition, but otherwise than that, there would not be. But anything else that's medical, as we talked about. So if you go to the clinic for an exam, if you get an x-ray, if you get those things, if you get pharmacy, that's related to your insurance. Does that make sense?
So would those, let's say those supplies, would those be billed to Medicare? Or those?
No, those are private charges. They are billed on the resident statement.
Okay.
So as you're an independent living resident, you get activities fees, meals, other meals or tickets.
Right.
If you're a healthcare resident, you get medical supplies.
Okay. Thank you.
Just as part of the bill.
Thank you.
You're welcome.
We had a question on the chat. Kate Adams asked, is a referral needed for Legacy's services?
A referral in particular to
Legacy's services? Legacy Rehab, I'm guessing?
I believe that any service, as Leanne said, that there's a coordination of care, it would go through the clinic. So if you see Dr. Bohr or that, I'm sure that that is part of the whole team process, that if you would need therapy, you would need an order for that. I don't know specifically, but I know Leanne was talking about you want to coordinate everything from the clinic.
Okay. And then Pat Thompson's asking, how is podiatry handled with regard to billing?
That would be the same thing. The podiatrist will bill your insurance or private pay if you don't, if it's not covered under insurance for what the podiatrist is doing. It would be just like Dr. Duffy or the x-ray or the labs.
Okay.
Okay.
Any other questions? Oh, okay. Chris?
Blue Medicare Advantage is the Medicare Advantage plan that the forest uses, because that's what we have and it works.
Thank you. They changed their names a couple times. So
Yeah.
I didn't want to say the wrong one, but the name's changed.
Yeah.
Thank you.
Okay. Anybody else? All right. I don't see anything else. So thank you so much, everyone, for joining us. Does anybody from the committee have anything else that they would like to say? Oh, okay. You just unmute yourself, Ms.
Okay.
Cushman.
We need to talk about next week. Next week we'll be hearing about maintenance and security from Nathan Summers and Charles Hudgens. Same time, same place, different speakers. That's all.
Great.
Hello, this is George Bosworth.
Okay.
Do you hear me?
Yes.
Okay. With PT, physical therapy, you need a letter. You need an order from your doctor if you're using an outside doctor for physical therapy.
Thank you, Mr. Bosworth.
All righty. All right. Well, if there's nothing else, then thank you so much and hope you have a great day, and we'll see you next week.
Thank you.
All right. Bye, everybody.